Hello, everyone, and welcome to another episode of Caregiving Gen X Style. I'm Steve Mullen.
And I'm Jennifer Mullen.
The phrase hospice care can lead to a lot of fear, maybe some depression, as many people simply see it as giving up and waiting for the death of your loved one. That's not really what it is. In this episode, we'll talk about it and try to dispel some myths. But first, Jennifer, how's your mom?
Gagi is slowly making her way back to whatever the new norm is going to be.
Independent-ish
Since the hospital stay. So I had a friend who said something to me that really stuck with me. So Gagi was in the hospital for 5 days. And my friend was thinking about a previous time when her mom, who's no longer with us, had a hospital stay. And the doctor had said to her, for every day in the hospital, that equates to 5 days of rehab. Now, that doesn't necessarily mean like in a rehab facility. We did not send Gagi to a rehab facility this time, and that was very intentional since my brother and I could be there with her. But that's actually been about right. She was in the hospital for 5 days, and then it's taken about 25 days to get her back to being more or less where she was before she went into the hospital. So it's definitely been a bit of a long road. I am so thankful to be back sleeping in my own home because I pretty much slept at her house for the better part of a month. I had a couple of nights on the weekend where my brother took over on the weekend so I could come home and sleep at home. So he was doing days, I was doing nights. So I was very thankful. I think I looked at you last week and said, oh my gosh, I get to get up and get for work in my own home tomorrow. And I have to think ahead for work outfits and...
Well, and on top of that, I mean, not only obviously we were going through that, which led to, us having to postpone an episode, which we've never had to do, and we felt really bad about doing. But, on top of that, you had to go travel for 3 days for work.
I did.
I was sick for 2 weeks.
Yes.
It's been a bit of trouble.
Yeah, it's been
this last month has not been a great deal of fun for anybody.
I was thinking about it today. We actually just got back from a lovely hike at one of the local national battlefields that are near us, and we were talking and saying I said like I feel a little bit like I missed fall this year. And it is what it is. But the month of October, in which all the fall things are happening and all the fall colors and all of that stuff, it's kind of just been a little bit of a blur, but all good. Mom has had a lot of in-home PT and OT and nurse visits. It's been a ton to keep up with. And again, my brother is days because I'm at the office, so he's really been keeping all of that moving. But it is definitely, it's gotten her strength back up, and we're trying to keep up a good pace of, exercises. This weekend I've been over there, each day to do exercises with her. So in some days she's more into that than others. But yeah, generally speaking, I think we're headed in the right direction. So,
good news.
Yep. So Steve, how's your mom?
She's doing good. Some exciting things over at the assisted living. Over the last few weeks, 2 people she knows moved in.
Yeah, that is exciting.
It is pretty cool. So one of them is a woman that she got to know in her previous assisted living. So she's another refugee from that horrible, horrible place where she used to live. And her daughter, who I've told about this podcast, but I don't think she listens. Her daughter is highly involved. She's pretty much visits her mother every single day at assisted living. And so she kind of works her way into the community and almost like she's a volunteer.
Yeah.
She helps out a lot.
Yeah.
And we'd kind of gotten to be sort of friendly, and we had texted back and forth here and there. Anytime something blew up over at our old assisted living, she would text me and say, oh, you're not going to believe how bad it's gotten now. And I kept saying, well, this place is good.
Yeah.
This place is good. And it finally got so bad that she had to get her out of there. And she just didn't want to move her. And I totally understand that because moving is
as we know.
Fun.
Yeah.
But she finally did it. So that woman moved in. And then pretty much at the same time, within a matter of 5 or 6 days, a woman who was a neighbor of my mother's at her, where she used to live when she was living independently in her house. A woman from that neighborhood has now moved in to the assisted living as well. And they were pretty good friends. She was close friends of my mother's best friend from the neighborhood. She was like across the street neighbors.
Yeah.
So they were kind of, I guess, second level friends, I guess you'd call it.
Remember, like sort of small worldish story about this particular neighbor
Oh,
is
yes.
she was there the day that we went and found your mom on the floor.
The incident.
Yeah, the incident.
Yes, the incident.
Yeah.
What did we call that episode? I can't remember, but it was the incident.
But it was the incident.
It was
so
the incident.
so your mom's like bestie from the neighborhood and
Yes.
this woman
Yes.
were the two who met us at the door that
Yes,
day.
they did.
When,
They did.
yeah.
They were there when we found my mother glassy-eyed and
Yeah.
on the floor.
Yeah.
So anyway, so now she's moved in, so that's cool.
Yeah.
It's kind of cool. At one point, so in the dining room, I think we had talked early in this podcast about dining rooms at assisted living, and what I've learned is the way things were at my mother's first assisted living is not necessarily the way things are at her current assisted
Yeah,
living.
I didn't like the way it was at the
It was
first
really,
place.
it was
too
practically assigned
regimented and,
seating.
Yeah, it was weird.
And I don't think that was done by the administration. That was really done by the residents. That's just the way they did things.
guess.
Now, at the new place, people bop around. They go from chair to chair, whatever. And at one point, there was my mom, there was her friends that she's made there already, and then these two new people, plus there was a gentleman that moved in who's apparently really nice. His name is...
and probably very popular.
Yes, his name is Burl.
Oh my gosh.
Yep. And
That is
and so he sits with the
classic.
ladies as well. And at one point they had just put tables together, like 4 tables together,
love
and
it.
they were all sitting together, kind of like family style.
Yeah,
Really
it's
cool.
awesome.
But the administration, for one reason or another, they asked them to stop doing
Yeah,
that. So I don't know why.
I'd love to
really
know
don't.
what the reasoning behind that is. Because
Maybe it was just access, having to go all the way around the
yeah,
table.
you know what? For other residents,
Yeah.
maybe with rollators and wheelchairs and
That's
having to navigate.
probably it.
Yeah, I
Probably.
guess.
And they were, where the table was, well, I wouldn't say it was blocking a door, but it made it harder to get to the door.
Okay,
So
well-
maybe for fire purposes, I don't know. So they've broken them up, and my mom's like, well, I don't know. I don't know who I'm going to sit with now. And I think she's worried that she's going to...
She doesn't want to hurt anyone's
She
feelings.
doesn't want to hurt anybody's feelings. And she actually does. The woman that moved over from her old assisted living, she said, I feel a little responsible for her because we didn't convince her. They already knew about this place, by the way. Her daughter, actually, in fact, her daughter's father-in-law used to live there years ago. And in fact, had the apartment that my mother lives in right now. Which is just a crazy coincidence. So she already knew about the place. It's not like we talked her into it.
Yeah.
But she does feel a little responsibility for her, and she wants to keep an eye on her.
Well.
And, I mean, it's nice of her.
Sure. Yeah.
So,
Yeah.
anyway, let's get on to our episode. There is a lot of confusion about hospice care. If we're being 100% honest, we didn't really understand a lot about it until a year and a half ago. And I think we're probably not the only ones.
Yeah, I think we're not. So hospice provides medical care and support for people who are nearing the end of their life and have stopped if they're on some type of treatment, right? They've stopped treatment. So generally it's recommended when medical professionals believe that, the person may not live more than 6 months or so. What it isn't, however, is a patient simply lying around waiting to die.
That's true.
For
So-
lack of a better way to put it.
And in this episode, we're going to go through the ABCs of what hospice is and what hospice is not. And later in this episode, we're going to hear from a listener and a Substack author. I don't know if you're familiar with Substack, but look it up, who has a lot of experience with hospice. She'll have some tips on how to deal with the process once you're in it. And so be sure to stick around till the end to listen for that.
Yeah, well, our experience with hospice comes from Nana's hospitalization in 2024 when she had a severe gastric bleed. Actually, we really had experience with hospice too, with your dad.
With my father,
with
it's
your
true.
dad,
It was a
which
long time ago.
23
Yeah,
years
he
ago,
was
24
in
years
hospice
ago.
at the end. He declared he was on an experimental treatment. He was in a, what do you call that?
A trial.
A trial. Thank you.
Yeah.
He was in a trial.
Yeah.
And he said to my mother at one point, I don't want to do this anymore.
Yeah.
And she just kind of let it go. And then he said it to me, and I pushed back. And then a week later, he said it again. And I said, okay, you know what that means? He said, I know exactly what it means.
So that was, I think, the more traditional
Yes.
version of hospice that people
Right,
think about.
right.
Like your dad was definitely, we all knew it. He was at the end of his life
Yes.
and he was ready to just be sort of peaceful about it.
And in the end, so they had in-home hospice for a little bit. And then as he got toward the end, he actually went into inpatient hospice. And that lasted really all of about, I think, 3 to 5 days.
It was,
It wasn't
he wasn't
long.
there for very
It
long.
wasn't long,
Yeah.
yeah.
So then let's talk about 2024 after Nana, your mom, had the severe gastric bleed. So there was a procedure trying to stop the bleeding. It really didn't work. And we were told at that time the only additional thing they could do was the drastic step of really opening up her belly and going in manually to stop it. And they said it was a really brutal surgery and frankly recommended against it given her age. So we agreed and we said, okay, well, what's the next step going to be? And we were told that hospice was our best bet.
Yeah. And so they brought this up. I'm in the room. My mother's in the room. She's just been told that she's still bleeding. And we're all a little, obviously, on edge. We're a little concerned. And they've said hospice. And my mother's eyes get really wide and she starts crying.
Yeah.
She's basically like, I'm going to die. Is that it?
Yeah.
And so they did eventually figure out another procedure that fixed the problem, thank goodness. But, you know, at that moment, my mother was still bleeding a little bit and we were very concerned. And we were told that, you know, her body might take care of it. It might close up on its own, but it might actually start up again at any moment. And, you know, once we were calmed down a little bit from our initial shock when they mentioned hospice, they sent the palliative care manager in to talk with us, and we learned about what hospice actually is.
Yeah. Well, I think the first thing to know is truly your loved one can be in hospice for a long time. Former President Jimmy Carter was in hospice care for more than 2 years. 2 years. So all hospice really means is that, you know, there's something wrong with them, but either you've decided against treatment, maybe there is no treatment, or you've realized that the treatment, frankly, is worse than doing nothing at all. So again, based on your mom's age, doing some brutal surgery did not make a whole lot of sense.
Right. And that moment, I mean, we've talked about that particular time a lot, but in that moment, I was very glad, I guess we'll call this a squirrel. I was very glad my mother and I both agreed that that was a terrible idea. Yeah. And I think the surgeon that was in with us was very brutally frank about it.
Yeah.
And he said I think he even said, this is bad. This is a really, really, really bad surgery. And you're looking at months and months and months of rehab after it. And the rehab may not work. You may never be the same.
Yeah.
And he basically talked us out of it, which I'm glad he did, because my first thought was, no, that's a terrible idea. But I was afraid my mother would say, let's do it.
Yeah. I'm not convinced she would have survived that.
I'm not sure she would have either.
Yeah.
But, you know, another thing to note, or one thing to note really about hospice care is when your loved one enters hospice, all attempts to cure them, like chemotherapy, for instance, will stop. From that point on, the goal is comfort.
Right. So there is that. Yes, there is that balance of hospice. Yes, it does mean you are going to stop basically. Well, I don't know that it's completely stopping medical intervention.
No. We're going to talk about that a little bit. We're going to come into that. But so I think cancer is really, I think, the best example of this. So for instance, like my father, he was going through a trial. He'd been doing, radiation therapy and stuff. He went into hospice. The trial stopped. The chemotherapy stopped. And they just kept him comfortable. Yeah. But, you know, what we are going to talk about, we'll get to this in a minute.
So there's treatments versus quote unquote medical intervention. Yeah, let's do that.
Let's jump ahead. Okay. So things like pain relief. Obviously, they'll take care of that if they're in pain. If there's anything else, like they have high blood pressure, they can continue taking the high blood pressure medication, for instance.
Right.
So, you know, actually, that's the next section of what we're talking about. So equipment and supplies, if you need that, wheelchair, shower chair, oxygen, that will be taken care of by hospice.
Even a hospital bed
from that point on. Yes, my father was in a hospital bed in the living room.
Yep.
And so, you know, you can receive support, in-home visits. You'll get training to ensure you know how to take care of whatever is going on with your loved one. You may also be able to arrange some respite care through hospice, which is very, very important, and we know people don't take advantage of near as much as they should. We're going to say it again. If it's there, take it.
Yeah. So actually, let me interject here. And so one of my employees right now is going through this with her mom. She and her sister ultimately, and her mom too, decided on hospice care. She's in end stage kidney failure. And that's one of the things that actually, she and her sister, much like my brother and I for the last, month with Gagi, nonstop 24/7 coverage. She and her sister have been doing 24/7 coverage. And by the way, they are not as fortunate as my brother and I are. Their mom does not live right around the corner. So it's a whole other thing, travel and, trying to coordinate who's staying and et cetera, et cetera. And she just said to me last week that they are hopefully going to start exploring potentially getting some respite care for someone, for someone to come in and help take care of some of the overnights, because it is just so exhausting. And again, it allows me to use my favorite analogy.
Oh boy.
Do you remember my favorite?
Oh, I know. Here we go.
Right?
Here it is.
There is reason when you are on an airplane that they tell you to put the oxygen mask on your face first. You have to save yourself first so that you can save others. It is the same thing with respite care when you're in this, my employee, at this situation or at this point in her mom's life, they cannot keep going at this pace. They just can't, and they need help. And I keep telling her she's got to be able to take care of herself and rest and, make sure she's staying healthy and strong, or she will be of no good to anyone.
Okay, but let's back up a second. I think that's at least the third, possibly fourth time you've used that analogy on this podcast.
But it's such a great analogy. Can we promise
that's the end of it?
Please, no. And any of you listeners out there who totally feel me when I'm saying that, please weigh in on that one, because it's true.
So the one last thing that you will receive, or you can receive rather, is bereavement support before and after. Because before, in certain circumstances, really, a hospice care, it's going to go on for a little while. But there's certain circumstances where it's not.
Yeah.
And you're reaching the end.
And you're kind of mourning even while the person is still alive.
We're actually, I have a plan for an episode. It may be a number of months before we do that. But we're going to do a whole episode on that topic. But so you can get some bereavement support and some therapeutical support as well.
Yeah. Well, and if your loved one is in hospice care and living at home, you'll receive regular visits from a member of your hospice team, and someone is going to be available to you 24 hours a day. So, that's critical. Just knowing that you have that support there at any point throughout the day when you need it is, I'm sure, a huge relief. However, just like any other home health situation, just when you get used to a home aide, it's possible they would switch you to another one. So it's sort of a fact of life when you're dealing, with something like hospice. So you can get really attached to folks. And I do think, generally speaking, they try not to do that any more than necessary, but it's possible, I guess.
It's possible.
Yeah.
If your loved one is in assisted living or a nursing home, they can still receive hospice care. A hospice nurse will come to them once or more a week to help with pain management, other things like bathing, et cetera, et cetera. And if there's an issue other than a true emergency, like they're sick or they need some help with something, the nursing home will not call 911 unless it is an emergency, but they'll call hospice instead, and the hospice will help deal with it.
Right, because you're not trying to do life-saving measures at that
exactly.
point. Yeah. Well, let's talk a little bit about inpatient hospice.
So this is where my father was for a week, maybe at the most.
And generally speaking, it's more short term. So it would be, appropriate if your loved one truly doesn't have a lot of time remaining before they pass, as we discussed at the top of this episode. I mean, we knew that with your dad. Or maybe something needs to be stabilized even before they can return home. So in this case, nurses and doctors will be responsible for their care, just like in a hospital. An inpatient hospice can be provided at a hospital or in a freestanding hospice facility, which, if I recall correctly, is what your dad was in.
No, my father, he was in a hospice facility that was in a hospital.
Okay.
It wasn't a hospital.
Okay.
Yeah, just down the road from where they lived.
Okay.
Another option that you may have heard of is palliative care. Generally, it starts earlier than hospice. For instance, if your loved one is diagnosed with cancer and may have years to live, hospice may not be appropriate yet. But in that case, palliative care may be the way to go. It's a situation where it's a pretty serious thing and it's something that may eventually get them, but it's not going to happen, say, 6 months from now. And I think 6 months, I don't know if we've mentioned that. 6 months is usually, if they expect that's about as long as they're going to last. That's kind of the time frame that they look at. And, if they go past that, that's fine too. But palliative care can be given while treatments for a condition are explored, such as chemotherapy for cancer. So that sort of thing can continue. Palliative care provides most of the same benefits as hospice, including comfort care, relief of symptoms, assistance for the caregiver, basically it's appropriate for someone who probably isn't going to get better, but isn't dying soon.
Right, right. Now, of course, the big question always is who pays for all of this?
Who's going to pay for all this stuff?
Yes. So if your loved one meets the requirements for hospice, then Medicare or Medicaid will pay 100% of the costs. Palliative care may also be covered, but not necessarily up to 100%. So your best bet is to check with your provider, your insurance company, always, right? Just to see what your out of pocket will be. And, it's not a bad thing if you're in a caregiving situation that, you're not yet at the point where you're talking about hospice or palliative care. So like us with our moms, not a bad idea even to explore and understand what the options are that are going to be available to you if and when that time comes.
Well, it's like we said in the last episode, we talked a lot about planning. This is one of those planning things that it's just good to know that that's available to you and what you can do.
And do it when you've got sort of the downtime. Like I think about that, this most recent situation with Gagi, we were here doing roughly the same thing about a year ago. And it's the in-between times when things are a little quieter and normal-ish, that's when you have the time to maybe explore and find out more information, just to tuck it away in your back pocket for when you need it.
Mm-hmm. So now that we've been through the ABCs of hospice care and also palliative care, we have some tips on how to handle it once you're in the middle of it. We received some tips from a woman named Dana Barnes. Now, Dana wrote a great Substack article. She contacted me about it, and I read it. It's really great. It's about her experience with hospice with her father, and she agreed to provide us some audio with her best tips about when you're in it. So take it away, Dana.
Hi, my name is Dana Barnes. I've been a caregiver for 2 family members who were receiving at-home hospice care. I have a few tips for managing the process. First, stay organized with spreadsheets and logs. Keep a record of symptoms and the medication schedule. Try not to be the super pest with hospice that I was, but be persistent. Advocate for your loved one. You might need to be their voice. Trust the care, but verify. Make sure your loved one is being treated with respect. The most important advice, ask. Ask nurses how to retain privacy and dignity. Ask the nurses about dying stages so you are prepared. Ask about resources if you become unable to handle care, such as respite care or continuous care. Ask about services that supplement hospice, either social workers and volunteers at the hospice or outside agencies. Finally, make sure to lean on your support network, local and virtual. Be present for these final moments and try to be relaxed whenever possible. Dying people can be very sensitive to stress, and many special moments can happen during this time as well.
Dana, we really appreciate you taking the time to do that. I will put a link to her Substack article. Again, I strongly recommend you give it a read. It'll be in the show notes to this episode. I'll probably put it on the Facebook page in the comments when I post this particular episode as well.
Yeah. Thanks, Dana, for that.
We really appreciate it.
Yep. And I actually love the last part of what you said. A lot of really special moments can happen there at the end. And I think that's probably true.
Oh, it's absolutely true.
Yep.
Yeah. I remember a couple of my dad, even when he was laying in hospice in the hospital, we basically knew we didn't have a lot of time. Yeah, so,
sometimes some of the most important things are said at those moments.
That's
I think.
True. Yeah. Absolutely true.
Yeah.
So thanks to everyone for listening to this episode. As always, if you want to get in touch with us, you have a question, you have a comment, if you have a company that wants to sponsor our podcast, we'd be more than happy to talk to you about that. You could email us at caregivinggenxstyle@gmail.com. You can text or leave us a voicemail. Please leave us a voicemail. 804-723-1221 is the phone number to call. And you can find us on Twitter, the handle @GenXCaregiving. Facebook is the place where we post the most. Go on to the show notes of this episode. You'll see a link to our Facebook page. Just click on it. It'll take you right over there. Click on follow us, and you'll get all the little extra stuff that I post on there. We hope to hear from you soon. Have a great day.
Good night, everyone.